We have taken this initiative of organizing an international conference on pre-diabetes mainly because this is a condition which is asymptomatic. That means there will not be any symptoms. So there will not be any pain in the body because of this condition. But if this is ignored, depending on the severity of these markers, it may lead to proper diabetes, type 2 diabetes condition. So if we want to avoid onset of diabetes or protect an individual from becoming a diabetic, it is very important to identify them at the pre-diabetic stage. So it is considered to be a window of opportunity. So to facilitate that identification of individuals with pre-diabetes, we have actually organized this conference so that we can sensitize many young nutritionists towards this condition, and individually or together, all of them will be able to contribute to this mission of identifying pre-diabetes individuals and helping them how to prevent progression of that condition into proper diabetes. So thereby our ultimate goal is to reduce the numbers of diabetic patients in our country. So that is the main objective. So the outcome of this conference would be like taking ahead the message as a public campaign, health campaign, sensitize more people in the community. But this requires a lot of efforts from multiple angles because our country, we have a multitude of cultures, different communities, different food habits and lifestyle habits. So we need to develop those strategies. So that is what we are looking at from this conference.
So taking from where Dr. Subhadra spoke, I'm Dr. Anjani Harish. I represent Dr. Mohan's Diabetes Specialty Center and Madras Diabetes Research Foundation, Chennai. The keynote speaker today was Dr. V. Mohan, the president of this organization, unfortunately just left. So just the title of his topic itself was Pre-Diabetes, a Ticking Bomb and a Window for Opportunity, which itself says about how it is important to identify people in this pre-diabetes stage, which is, in simple terms, you can call it early diabetes stage. So what is happening is you identify people before they get diabetes. Now we are a huge research organization and we've just found out that how India has topping the ranks of diabetes and pre-diabetes. So we have 101 million people with diabetes in India and we have 136 million people with pre-diabetes. So just think of the number, it's bigger than any country, right? Just the people with pre-diabetes and diabetes. So if we want to treat and take care of these people and avoid them from getting diabetes, these 136 million people, if they go on to get diabetes, then what will happen? We do not have such a great doctor to patient ratio in India, and if we are going to have all these people going into that stage, then complications set in. So there are a lot of issues that has to be taken care of. Instead, pre-diabetes is something that can be nurtured, that can be taken care of by the clinical dietitians, by the nutritionists, and a team of allied workers along with the doctor. So a good lifestyle and exercise, regular exercise, all this will help in the prevention of diabetes. And hence, I would like to really congratulate Sir, Ma'am, LSI team, the whole the Swasthyam team, because this is, as far as my knowledge goes, please, I can have anyone correct me if I'm wrong, this is the first conference on pre-diabetes. Everyone has conference on diabetes and its complications. So it's a great initiative and we need to have a lot on this so that, everyone understands how important it is to treat people with pre-diabetes and basically ensure prevention of diabetes. This is the right stage.
Right. Ma'am, your views on this initiative?
I'm Dr. Neha Savalka. I'm a visiting faculty at LSI as well as director of ASNHR. We at LSI, our whole mission is integrative nutrition and dietetics, and we as nutrition community play a major role in prevention of from pre-diabetes to diabetes. So at LSI, we thought that this is the best thing to come out with as the theme for the conference. This is the first international conference that we at LSI are organizing, and we thought that rather than using the same themes that have been done till now, we should focus on something wherein we can really play a role in prevention of something. Right. So we have so many people in audience and now they will go, and some of them are students, some of them are professionals. Students will become professionals at the end of the day. So when they go in the community, when they go and work, through our initiative at LSI, we are trying to make them, empower them to prevent that conversion from pre-diabetes to diabetes.
Right. Sir, how much? Sir, will go ahead. So, sir, wanted to know like ma'am said, how much is it important to brief the students to prevent diabetes before it happens? Sir, your views.
Please.
It is very important. See, students are the future of tomorrow.
Right.
So, if we don't
Sukhada.
teach them, if we don't guide them, how are they going to know what needs to be done? And students, not just when they become professionals, they can start right at their homes now, with their parents, with their family, with their friends who are not into this field of work. So we are not just waiting for them to become professionals. We are starting right at young age that they can actually increase that awareness. And now if you ask us at LSI, or even like I teach at also at ASNH also, what we're trying to do at LSI also, our students are all on social media. They create reels, they have their own handles, the students of LSI. So they will spread awareness in the field. So it's not that we have to wait to become a professional to know about this information. They can start right when they are studying itself.
Yeah, I
So
can
catch them
add.
young is your mantra.
Yes,
Yes.
absolutely.
I can add to this. Actually, your question is very important question. So students are learning various subjects in integrative nutrition and dietetics. So at LSI, we pay equal attention to all pillars of lifestyle. So they learn about how sleep is important, how stress management is important. All these things they learn theoretically, but here when they are hearing all these speakers practically working on it in the form of research and research outcome, they know the practical applications. So in the development of strategies, it has to be condition specific. So when they are developing strategies, they know how to develop such strategies for pre-diabetes patients and use them so that they can educate pre-diabetes patients in a holistic way.
Right.
So that is how the students will get additional information from the researchers who are directly into that kind of research. So that is the focus of this conference, and where students are being their knowledge is being updated and they are imparted more skills. We had 2 pre-conference workshops also. So that has enhanced their knowledge and skills as well. So it will give them broader perspective of how to deal with these such kind of patients, whether within their houses or outside. And LSI has actually started an initiative of public health education in pre-diabetes through some street plays.
Yeah.
So we have trained one batch or two batches from each college, and we had intercollegiate competition also in that, so that collectively we will be able to do it. So
Is
that
LSI
is
an NGO?
no, Lifeness Science Institute is an educational partner.
It's an
educational
educational
partner
partner.
and offering all these undergraduate and postgraduate courses in integrative nutrition and dietetics through autonomous colleges. So Mumbai University courses. These are. So but still
what
they
constitutes the current audience, as in you said all are students?
no, they actually current audience more or less 50% are students, and all of them are postgraduate students of nutrition from various colleges across India. Okay, then there are the remaining 50% are professionals. They are practicing dietitians, they are nutritionists who are into research, and some are working with industry, NGOs. It's a very good combination. We also have doctors.
Yes.
Not only from Mumbai, even in doctors who are working in rural areas like Derwan, and also a team of doctors, they have come because they started identifying pre-diabetes as well as diabetes in rural and tribal areas. So they have got their own data also now. So they are going to share that data with everybody tomorrow.
So in the conference room, I was there for a few minutes.
Yeah.
I saw there were discussions about what type of foods should consume. As in there was some discussion about brown basmati rice versus
Quiz.
roti. So all these things also will be covered. What
Will
type
be
of
covered.
foods should be?
Absolutely.
Tomorrow.
Because we are going to have panel discussions and power talks from Indian Dietetic Association members. I think Sukhada also can throw more light on that.
Any paper presentations?
Yes.
So one very good aspect of this particular conference is the topic is on pre-diabetes, like Ranjini rightly said that this has never been done. Usually the focus is always on the problem. After the problem has occurred, how do we correct it? Pre-diabetes is a condition before diabetes, so therefore there is scope of acting early and preventing that from becoming a bigger problem. India is the diabetes capital of the world, and today in India itself, 15% of our Indian population, which is the population of the whole of Maharashtra, is pre-diabetic. So imagine the gravity of the issue. And rightly so, LSI Future Velocity Group has brought together 5 different associations who work in various aspects. Indian Dietetic Association Mumbai chapter, there's Nutrition Society of India, there's ASNHR, there's IPIN, Diabetes
And
India Core
ASNFS.
Group, and Denmark Healthcare.
ASNFS also.
Yes, and
ASNFS also. These associations have come together. They work, some work in fitness areas, some of them are clinical dietitians in hospitals. It's very important that there are 500 people in that room. They need to reach 1,000 others and spread the message, which is very important, and rightly so. Ma'am has very nicely curated those pre-conference workshops also, when these dietitians are going to be trained to do this in the community.
I'd like to answer your question. We do have paper presentations from students. We have oral as well as poster presentations. So we're giving this opportunity to researchers across India, and I would like to say that we've got researchers really from across India, from Ludhiana, from Chennai, from Bangalore, of course from Mumbai, and many other cities. We've got abstracts that have been presented, and these sessions will be held tomorrow, and there'll be oral as well as poster presentations. So we are giving opportunities to researchers across India to present at the conference. And of course, we have 2 international speakers with us. One we have here right now, Dr. Tatiana Rock. She is from Deakin University, Australia, and Dr. Kalpana Bhaskaran will be coming from Singapore. She'll be coming tomorrow. So it's not just that we have restricted ourselves to speaker in India. We have invited people who are working in the field from abroad. So make sure that we are not restricting ourselves to knowledge. We want to cover and let our students as well as delegates who come from across India to know what's happening around the world, because it's very important that we do a fine balance of what's happening here as well as abroad. Only then we can guide our students or the fraternity for the best outcomes and to prevent diabetes.
And we have international speaker with us, Dr. Tatiana Rocks, whose specialty area is mental health and nutrition.
Wow. So my name is Tatiana Rox. I'm a senior research fellow and director of the Academy Food and Mood Academy at Deakin University, Australia. So we research nutritional psychiatry. So it's an area of research and practice which link the food we eat with our mental health. We have horrendous numbers happening right now with prediabetes in India, but we also have very poor mental health right across the world. So today I presented how issues of mental health relate to diabetes. And I also talk about our gut health. That's another very important area which often overlook. We focus on metabolic health and weight and size, but we don't talk enough about gut issue and how important diet quality is for gut issue. And I understand that India does face a lot of difficulties when it's come to overall metabolic health and pre-diabetes in particular. And this is why I would like to congratulate LSA on such a wonderful initiative, on your vision and all your work in organizing such an important event. I'm so amazed and very pleased to see so many students and how keen they are to learn more, to understand more, and to use that knowledge in practice to help prevent absolute public health crisis, which unfortunately unfolding right now.
And if you see the list of topics that ma'am has curated, you have a bunch of, you have case studies, then you have research being presented, it's like scientist bias, or large-scale epidemiology studies, so what happens in the community. Then, so we have a lot of data, we're presenting that, but then there's also a lot of individual dietitians, nutritionists presenting their experience, which is also important because it's an experience from all over India. It's not like, this happens in Bombay, so it doesn't happen in Delhi or something like that. So each one comes up with their perspective. And when you give that kind of inputs to the budding nutritionists and even working professionals, everyone likes to learn from each other's experience. And as I said, this is the stage for primary prevention. We talk about different types of prevention in diabetes, and these are the early stages. So what you do at the home level, that is, if we practice it at our home, it becomes primordial. But if you're doing primary prevention as a person who has pre-diabetes, we're doing primary prevention. So at every level, this can work. So it's an important message, take-home message for everyone.
Yeah, and because it is so important, even the hospital, Kokilabhen is a collaborator on the entire conference. And we have had speakers throughout the day today who are from the hospital, because they also realize, including the HOD of